Hi, this is Dr. DC. I went to see Ryan and Mitt Romney visiting Norfolk. Mitt Romney made a very bad choice as Paul Ryan as a running mate. Let me tell you why. Here's Paul Ryan's lies.
You are getting, and so am I, every journalist is getting a lot of email right now pointing out to what they claim are falsehoods, misleading statements, lies, if you will, that were made by Paul Ryan. And I guess those fact-checking is only about just getting ready to begin.
They needed hundreds of billions more, so they just took it all away from Medicare. $716 billion funneled out of Medicare by President Obama.
It's bogus. I hate to put a fine point on it.
Benefits to seniors actually increase under Obamacare.
To your Medicare point, the Ryan budget actually also assumed the same $716 billion in Medicare savings.
In Janesville, where we were about to lose a major factory, right there at that plant, candidate Obama said, "I believe that if our government is there to support you, this plant will be here for another 100 years. As it turned out, that plant didn't last another year.
One thing Paul Ryan talked about was that GM plant that closed in Janesville. That plant was shut down under the Bush administration.
The stimulus was a case of political patronage, corporate welfare, and cronyism at their worst.
And now we learn that the anti-stimulus crusader Ryan, in fact, asked for stimulus money for two companies. That's something he's consistently denied, but yesterday was forced to concede the bottom point.
He created a new bipartisan debt commission. They came back with an urgent report. He thanked them, sent them on their way, and then did exactly nothing.
He also criticized the president for doing nothing about the Bowles-Simpson plan. He was a member of the Bowles-Simpson Commission, and he voted against it.
I thought it was a very constricted, very negative, very nasty speech.
Here's Ryan giving $40 billion to Exxon tax break. Here are the Paul Ryan's budget cuts. Cut Medicare, cut Medicaid, safety net, home mortgage deduction. But tax cuts for the rich, that's his main goal. This also shows how he supports the billionaires and not the middle class. Tax cut for billionaires, Social Security benefits cuts for retirees, Medicare cuts to coming generations, tax cuts for millionaires and billionaires. Here's Mitt Mao, thoughts of Mitt Mao, jobs for China. This is what he's doing. This shows how Bain Capital, owned by Mitt Romney, sent thousands of jobs to China. 800 US companies are going to China. GST Steel in Kansas, under Bain and Romney, closed the GST Steel plant in Kansas. Here's a worker who talks about it.
I don't think Mitt Romney understands what he's done to people's lives by closing the plant. I don't think he realizes that people's lives completely changed. When Mitt Romney and Bain closed the plant, I lost my health care. And my family lost their health care. And a short time after that, my wife became ill. I don't know how long she was sick. And I think maybe she didn't say anything because she knew that we couldn't afford the insurance. And then one day she became ill, and I took her up to the Jackson County Hospital and admitted her for pneumonia, and that's when they found the cancer. And by then it was stage 4. There was nothing they could do for her. And she passed away in 22 days. I do not think Mitt Romney realizes what he's done to anyone. And furthermore, I do not think Mitt Romney is concerned.
Priorities USA Action is responsible.
Death by China, a great movie made by Peter Navarro, investigates the bad economic relationship with China. China began flooding US markets with illegally subsidized products in 2001. Over 50,000 American factories have closed. 25 million Americans can't find a decent job. America now owes more than $3 trillion to the world's largest totalitarian nation, China. This is a short summary of the movie Death by China.
I was laid off 3 times within 6 months until I was permanently laid off.
I graduated with my bachelor's and I haven't been able to find anything.
Jobs disappear. And the way the economy's going right now, it's tough to find a job.
When the workers in China are being abused, then workers in America have a tougher time competing against them.
5.5 million manufacturing jobs gone.
57,000 manufacturing facilities closed in this nation.
Some of the workers at companies, literally their last act at the factory was to unbolt the machine and load it up to be shipped off to China.
There's no question that a large part of China's competitive advantage has come from environmental neglect.
16 of the world's 20th dirtiest cities are located in the People's Republic.
That leads to carbon emissions and particulate matter falling all along the coast of the United States.
If you put it in your mouth or the hands of a child, don't buy it from China.
They're not only ruining our economy, they're poisoning our children with the toys that we give them.
China until today is a totalitarian regime, is a dynasty, not republic, not people's country.
China's military power is strengthening very, very rapidly.
It's developing a modern, well-equipped, technologically capable military.
China is the only major nation in the world that is preparing to kill Americans.
We're a subsidiary of China and getting worse and worse because they're going to own us pretty soon.
If we talk about who's to blame, I think partially our own government.
Our government should be doing something.
They could have stepped in, I think, a long time ago.
Please hear us.
I think that at every level, people could boycott and there would be a shot heard around the world.
Here's Mitt Mao again, who's helping the Chinese. This is why we need single-payer healthcare. We saw the video about the guy who lost his job and his wife died from cancer because they couldn't get any insurance. Single payer would cover everybody and no deductibles. This shows the insurance industry, drug companies and the hospitals, how they are robbing American money for profits, not giving health care. These are the facts about single-payer health care.
Nearly 304 million people live in the United States of America. How many of these people should have access to health care? 47 million people do not have health insurance. 30% of young adults are uninsured. 1 in 10 U.S. citizens between the ages of 18 and 64 cannot afford necessary prescription drugs. 10% of U.S. citizens must delay receiving needed care due to cost. 1 in 10 U.S. citizens 45 to 64 years old have no insurance. 50% of them will be diagnosed with high blood pressure, serious heart conditions, diabetes. Every 30 seconds, someone in the U.S. files for bankruptcy due to medical debt. The quality of the U.S. healthcare system is ranked 37th in the world. Every year, 7 out of 1,000 babies die in the U.S. at birth. 101,000 people die each year because of lack of necessary medical procedures in the U.S. The United States of America is the only industrialized country in the world that does not provide universal insurance to its residents. We know this is a problem, but what is the solution? Representative John Conyers suggests a very simple idea. Expand and improve Medicare for everybody. A single-payer national health care plan. Single-payer is universal and guaranteed, comprehensive, filled with free choice, cost-effective, good for the U.S. economy, and brings back pride to our country. Everyone is automatically included in this health care plan from birth to death, regardless of unemployment, health status, or ability to pay. A single-payer plan will cover all medically necessary primary and specialist care, hospital visits, prescriptions, home care, long-term care, mental health, dental, vision, hearing, physical therapy, chiropractic, preventative care, and more. No out-of-pocket expenses, no copays, no deductibles, no coinsurance. People in the United States love choice, and with the single-payer system, you'll have more choice because you can go to any doctor in any hospital anywhere in the U.S. without worrying that you will be out of network or denied care. The single-payer plan is very cost-effective because healthcare costs are spread out and everyone contributes to one healthcare fund. This is already how we pay for other necessary services, such as the fire department, public education, and the police. Physicians for National Health Program, PNHP, believes
we can provide health care for all citizens and save $300 billion a year with using single-payer health care. This shows growth of physicians and administrators. Look at the number of administrators growing compared to physicians, which is in red. I met Paul Ryan when he came to Norfolk, and I asked him the question about single payer. This is what he said.
I'm a doctor. What do you think about single payer health care?
I don't. I'm not a fan of single payer. I think we should have a private system of choice. You can go over there. I'm going to go this way.
Then I met Ann Romney.
Hi, Ann. Congratulations. Thank you. I'm a doctor. What do you think of the single payer health care?
Well, we have to get it affordable first.
There we go. They say you can.
They are the protesters in Norfolk when they were visiting. There were a lot of protesters against Romney's and Ryan. More protesters. Dr. Margaret Flowers is the best advocate for single payer in the United States. Here is her interview with Bill Myers.
What made you such a passionate advocate for single payer?
Well, I went into medicine because I really do care about taking care of my patients, and particularly I chose pediatrics because I feel like if you give children a great start, a healthy start, they can carry that with them through the rest of their lives. And when I looked at what was going on and looked at what works in other places and what has worked here, what models have worked here, I saw that if we have a Medicare for All system, then doctors can practice medicine again, the art that we trained to do.
Why did you feel you weren't able to do the medicine you wanted to do because of the healthcare system?
Well, it started when I was working in the rural hospital where I was, and when we would admit a patient to the hospital, the first person that would come to visit us was someone from Utilization Review, which is the group that interfaces with the insurance company, and they would say, you have this many days to make this patient better. This is how many days they've been authorized for. And what we often found is that didn't match the number of days that we felt the patient needed to be in the hospital. So it puts you in a really uncomfortable position of, do you send a child home before they're ready? And then in private practice, it's the same kind of thing. You see a patient, you determine what's the best treatment, and then the insurance company says, no, they can't have that test or they can't have that medicine. It didn't make sense. It wasn't based on what the patients need. It was based on what the insurance companies.
Single payer healthcare. Let's move clinic to China so we can save money. On my first day in office, Mitt Romney said, I vow to deny healthcare for 50 million Americans. Senator Bernie Sanders from Vermont is one of the great advocates for single payer. Private health insurance is like a hospital gown. Chances are you are not covered. Healthcare is a human right. Let's talk about war. Romney wants to start with Iran. Even the fellow Republican O'Reilly thinks that will start a World War III.
Sure that we have military options that combined with crippling sanctions.
Of course we have military options.
Well, but we have developed in a way that Iran understands we would use military options. In my
view, you're a tough guy. You're going to stare them down and say, look, I'm going to use them? Because if you bomb Iran, that starts World War III. You know that. I mean, they're going to try to block Hormuz. Oil will double. The unintended consequences all against the United States all over the Muslim world will be horrible. That's what Iran is banking on.
Cost of war, $800 billion, and 5,000 American soldiers have lost their life based on a lie. WMDs. Iraq didn't have WMDs. Saddam Hussein did not have WMDs. Look at what we did to our soldiers. They lost their lives. And George Bush never fought any wars, nor did Dick Cheney. He didn't show up. Look at the damage to our soldiers. This is the cost of war. Cost of war. CPR in progress. Soldier shot by the enemies. This is what we get. Every gun that is made, every warship that is launched, every rocket that is fired, in the final sense, signifies a theft from those who hunger and are not fed, those that are cold and not clothed, said President Eisenhower. Why did Bush administration start the war? This is for profits for war machines, a fatal vision. These are the profiteers from the war, military contractors. This is the cost of war. Building blocks of the deficit, economic recession, huge tax cuts for the wealthy, cost of Iraq and Afghan wars. Republicans object to ending Bush's wars. Did the war make us safer? No. Look at the terrorist threats have gone up 38%. Cost of war, debt. Look at the war debt. Is Mitt Romney. Mitt Romney is a bully. Romney, the bully, forcibly cuts the hair of a classmate. Here's a video.
Mitt Romney's apology comes after 5 of his former high school classmates described the same incident to the Washington Post, the targeting of another boy because most of them thought he was gay, holding him down and cutting off his long hair that he dyed blonde. One of those former classmates, Philip Maxwell, now a lawyer, telling ABC News, "It's something you don't forget. When I saw the look on his face, it was a look I'll never forget. When you see a victim, the sense of trust betrayed in this boy who was perfectly innocent for being different." Maxwell said he and Romney were among the boys who held the boy down, and that Romney was holding the scissors. "I saw it with my own eyes. It was a hack job, clumps of hair taken off." When Romney was asked if he remembers the incident, if he knew the boy was gay, Romney is now apologizing.
There's no question but that I did some stupid things when I was in high school, and obviously if I hurt anyone by virtue of that, I would be very sorry for it and apologize for it.
Tax cut for the wealthy. Jobless benefits, they had to get out. Too much weight, you get off the boat. Thanks for watching. Dr. DC from Norfolk.